Hello, my name is Annalie Martin. Today I am going to be going over range of motion. So the first thing I would like to talk about is that active range of motion is when the patient performs what you're asking by themselves, and passive is when you help them to perform that skill. So one form of range of motion is going to be extension, and that is going to be something like lifting your hand up, and then flexion, putting your hand down. Now, abduct is going to be putting your arm like up, and adduction would be down. And then we also have medial rotation, which would be like turning your foot in, and then we have lateral rotation. Example with that would be turning your foot out. Then we also have circumduction, which would be like rolling your hands in a circle, or rolling your feet in a circle. And then we also have inversion, which is turning your feet in. And well, I'm using your feet because that's what I studied, but it could also be other forms of the body as well. And then eversion would be like, turning them out. So supination is going to be similar to how your hands would be when you're laying like in the supine position. And I always remind myself of that by your holding cans of soup. And pronation is going to be when your hands are down, just like when you're down in the prone position. Okay, so when you do the range of motion exercises, you'll always want to start at the head of the body and then move your way down. So of course you will perform hand hygiene, and you will also check the patient's ID band to make sure that, and ask them what their name is to make sure that it matches. So after that, you will also want to only uncover the limb that you're using to maintain that privacy. So that is very important to make sure that, that you do keep that patient covered. So if you're starting with the head, you would first ask them to, you could start with asking them to turn their head to the side. So they would go like that, then back to neutral, and then you could have them do that twice. Okay, and then next you could also ask them to move their head up and down, or say yes, up and down, twice. And then you could also have them move their head side to side like this. Back to neutral, and then other side. Okay, and then once they are done with that, you can also, then you can move to their arm. So for the arms, you are gonna have them, they can move their arm up and down, up and down. You can have them flex their arm in, then you can have them move, move to the fingers, have them spread all their fingers, and then you can move to their wrist. You can have them bend their wrists up and down and make sure that they relax it. You can have them touch each finger like that. Okay, and then you can cover up the top half of them and move down to their leg. Now for the leg, you can have them just lift their leg up, not that far, but as far as they can comfortably move it. And this may be a position that you may need to help them with if the patient is a little bit more weak and they don't have so much strength in their leg. This would be a good one to help if they need. And you can always ask them if they're comfortable, and if there is any way you can help them. So they will move the leg that way. They can swing their leg out. They can cross their leg over to the other side. And then you can also do the lower leg, having them just bend that lower leg up and down. And then you can also move to the ankle. You can have them point their toes and then move their toes back, point, move them back. With the toes, you can have them curl their toes, and you can have them spread their toes apart. and just practice all of those different range of motions that we talked about earlier. You could, depending on the patient and what you are what you're planning, what your goal is, you could also have them do circumduction with their arms and legs. So, all right.